Hello everyone, welcome back to the Pharmacology Masterclass by Dentospedia, one of the trusted platform for dental board examination preparation. So the topic for today is drugs in lactation and pregnancy. It is one of the most important topic, not for your examination point of view, but also for your clinical practice, because you should know that what are the drugs that are contraindicated and indicated for both pregnancy case and also for a lactation case to provide safe and effective dental care to the pregnant woman and lactating mother and to prevent any complications to the fetus. So let's start. So the pregnancy and the lactation brings a major physiological changes that influence the drug absorption, distribution, metabolism, and elimination. So it will also affect the pharmacokinetics of the drug. For dental professional, the goal is to treat the oral conditions effectively without compromising the maternal and the fetal health. So, in pregnancy, there is also a main concern about the oral health. So, because you must have been knowing in periodontics, you will be studying that gingivitis is one of the most common issue that happens in pregnancy. So, we have to treat that oral condition, and also in pregnancy, there are where multiple physiological changes happens to a mother. So, it will affect the pharmacokinetics of the drugs also. That is the drug absorption, distribution, metabolism, and elimination. Dental care during pregnancy and lactation. So, in a pregnant lady, there will be increased blood volume, altered GI absorption, hormonal changes, decreased drug metabolism, decreased renal excretion. These are the changes that happen, and also in lactation also there are varieties of changes that happens to a mother, and we have to be utmost safe in prescribing drugs because it can go to the baby also while the mother milk. And we have to assess the risk and the benefits, choose the pregnancy safe medication, very much important, that we will be studying later on. Minimizing the exposure of the radiation, it is also very important for a mother and the baby. And consultation and educating the patient, the mother, and also the caregiver of that to a very great extent. So, prescribing during pregnancy requires a careful evaluation of the gestational age, that is the trimester, very important, because we have been also discussed in the previous chapter that second trimester is basically the safest for every treatment. Okay, so we have to have the knowledge about the gestational age, placental transfer, and the teratogenic risk is also very important. It increases in the first trimester. That's why we basically avoid any medication or treatment in the first trimester and also in the third trimester. FDA safety categories, that is the very important, and new PLR format. PLR is the pregnancy, lactation, labeling lure. So basically, it's a rule which will provide you the format about when and how and what to prescribe in a lactating mother. And also FDA safety categories, that is divided into X, A, B, C, D, because in the previous videos I have also told you some of the drugs that is there in the category B drugs. So that is very much safe for a mother. So you have to understand this FDA category, lactation transfer, and the infant risks, because lactation is something that it can also put the risk to the baby. So you have to be very much careful about the drugs. Timing and urgency of the dental procedure, mostly it is this you have to remember also for MCQ and also for a clinical practice, that second trimester is the preferable for any pregnant lady to have any medication or any dental treatment. But if there is some urgency and emergency, they can have first and they can have treatment in the first and the third trimester with utmost cautious. Okay, generally we avoid, but if there is any emergency that you have to treat it anyhow, then you can do it with very much a safe environment. Okay, now this chapter you will be having a practical idea, evidence-based guides to help dental practitioners confidently choose the safe pharmacological agents, avoid known risk, and understand how to manage common dental condition in a pregnant and the breastfeeding patients. So the first and the very important is the FDA pregnancy category, that is a legacy system. The FDA pregnancy category is divided into A, B, C, D, X. Okay, these are the categories. and were used to rate medications safely during pregnancy, though replaced by PLLR in 2015. These categories still appear in older materials and international drug references. They classify drug by the fetal risk based on the animal and the human data. Okay, this is also important from where it is based. And dental professionals should be familiar with this category to prescribe safely for a pregnant lady. Now, important. First is the category A. Category A, okay. Category A will be having the control study show no risk. It is the safest. You can have the levothyroxine, folic acid, that is a vitamin B9, okay. Category B, no evidence of the risk in the human. It is also safe. We have learned it in the previous lectures. Amoxicillin, paracetamol, lidocaine is also there in the category B. Category C, risk cannot be ruled out, like clindamycin, mopridocin. That is, it can be given, but there can be have risk in some of the patients. So you have to be very much careful. Category D, positive evidence of risk. There is a noted risk in the documents that there. So it is tetracycline phenyldoing. So we will be learning of this risk, that is tetracycline. We have learned in the last chapter. It is responsible for the tooth discoloration. So it is basically a risk for the pregnant lady and also for the fetus. And category X is totally contraindicated in pregnancy. It is isotretinoin and the warfarin. It is at most, it will put the, definitely it will put the mother and the baby at risk. So these are some of the categories you need to know. Now, this is the note. Since 2015, the FDA has replaced these with the PLLRI, that is pregnancy and the lactation labeling rules, which provide a narrative risk summaries and clinical consideration and data. Now, safe drugs classes in a pregnancy for a dental use specifically. Managing dental issue in a pregnant lady involves choosing drugs that benefits the mother while protecting the fetus. This section covers the drug classes commonly used in the dentistry that are considered safe during pregnancy based on the clinical data and the FDA guidance. Knowing this option help dental professionals avoid teratogenic risk and also provide effective care across all the trimesters. Now, the first one is the analgesic, very commonly used. So the preferred agent is the paracetamol. As we have discussed in a lot of time, that paracetamol is one of the safest of all. And it is a first line pain control throughout the pregnancy. Antibiotics, you can use penicillin, that is amoxicillin, cephalosporins, clindamycin can also be used in penicillin allergic patient, metronidazole, second and third trimester. Avoid tetracycline, metronidazole in the first trimester, used with cautions. Avoid tetracycline completely, but you can use metronidazole in a first trimester and also in all other trimester also with cautions. Local anesthetic, local lidocaine with epinephrine, that is a category B drug, so it can be used. It is safe. Use minimum vasoconstrictor. Antifungals, you can use the nystatin, that is a topical one. Amikonazole is a topical one. Systemic azoles is example fluconazole should be avoided because it can have the systemic toxicity to the mother and also the baby. Antiseptic, you can use chlorhexidine mouthwash. It is safe, topical, avoid systemic uses. And sedative, you can go with the nitrous oxide, avoid in the first trimester. This has to be noted. Short use in second and third is acceptable with a scavenger system. What is a scavenger system? Scavenger system is that system which will be helping you to give nitrous oxide with oxygen in a very limited amount. So basically just a system, you just remember the name, not go into detail of it. So this is just a chart, very important, you need to remember it. So thank you so much for watching. I hope you liked the video, and please download our app Dentospedia for more structured and curated module for pharmacology. Not only pharmacology, every subject you will be getting here in a very structured format, from video lectures to quizzes to mock tests to everything that you need for your examination that will ace your preparation. So thank you so much and happy learning.